Every single day, patients walk into my clinics in Salman and Peshawar with one question. Doctor, do I need a facelift? Or can I just get away with threads or HIFU? We live in a world of quick fixes. Everyone wants to look good, and they want to do that with minimum possible procedures. So we have certain non-surgical options, HIFU, threads, and the surgical facelift. The non-surgical treatments like HIFU and threads, they are fantastic, but they're not magic wands that they'll change everything. And surgical facelift, it sounds scary, but it is not as scary as you think it is. Let's start with the non-surgical options. HIFU, high intensity focused ultrasound. Threads, if you are in your 30s, early 40s, and you have mild sagging of the cheeks, mild smile lines coming in, that's where you can go away with HIFU. HIFU will tighten up the skin by heating it up. Threads, on the other hand, it physically lifts the skin and it tightens it up and stimulate the formation of collagen. Both of these procedures have a certain time period. The pros, very less downtime. You walk into the clinic, get the procedure, people won't even notice anything after HIFU. With threads, you might have swelling for a few days, but you get a tightened, refreshed look with minimal downtime. Now let's talk about the gold standard, the true facelift, the surgical facelift. If you have significant jowls, deep smile lines, neck, sagging, threads won't do, HIFU won't do. We'll need some sort of a procedure to surgically lift the skin up, replace the volume underneath, tighten it up and fix it up. That's the surgical facelift. Now, surgical facelift takes you back 10 years. If you're in your 60s and 70s, it can even take you back 20 years. And then it lasts for about 10 to 15 years based on your aging pattern, based on your weight loss pattern. The cons, it comes at the price of a scar. The scar is concealed in the hairline, in front of the ear and behind the ear. And it goes away. And the scar, it is there for the first 3 to 6 months, but gradually fades away and becomes inconspicuous over the period of time. So how do you choose between these two procedures, the surgical or the non-surgical? It's simple. If you are aging early, we cannot control that with serums and creams, so we need needles. We either need a HIFU or we need the needles with the threads, fillers and Botox. That would slow down your aging. That would stimulate collagen. That would tighten up your skin. But if the aging is already done, the damage has already been done, then we need the surgical facelift to undo it. That's the main difference between the two. My philosophy of facelift is very different, but it's very simple. If you are scared of surgery, don't do that. Go for the non-surgical lifts. Once you're okay with the non-surgical lifts, then you're mentally prepared to put on the gas pedal and go to the next step. So I always recommend doing some sort of non-surgical procedures first before going for surgery. There are certain reasons for that. The first one, you move a step ahead from creams and serums to needles. Needles give you a subtle but very effective change. Once you like that change, you can either repeat it after some time or you can step ahead and go to the surgical one. A lot of patients come in, they want to go to surgery right away. But I discourage that because you're not mentally ready to undergo such a big change. The change actually is not big per se, but it's in our minds. We age, we look at ourselves daily. We have a perception, we have an image in our mind of ourselves. That image takes time to improve. You cannot just follow the elevator pattern and change everything with surgery. Better to go with needles first, gradually go up and do the surgery. We offer you all of these procedures under one roof, under my care. Get a consultation with me and subscribe to our channel for more informative videos. Thank you.